Hello class, in this video I want to talk to you about the principles of bioethics. You can read about these on pages 8 through 13 in your textbook, which is part of the reading assignment for this week. Okay, so we have 5 principles that I want to talk about. Let me give you an example to help illustrate, and then we'll talk about the principles more generally. Imagine you go to the doctor with a headache, and you say, "Doctor, is there anything I can get in order to cure this headache?" And the doctor says, "Why, yes, of course there is. In fact, I have a syringe right here. If I just give you a shot in the arm with this syringe, it'll cure your headache instantaneously." However, there are 2 side effects. First, it's going to make you infertile. Second, it's going to take 10 years off your life. And you say, "No thanks, please, I don't want that. Is there anything else you have?" But before the doctor answers, she sticks you with the needle. And sure enough, she was right. It cured your headache instantaneously. But now you're worried that you're never going to be able to have kids, and you're going to die 10 years earlier than you otherwise would have. Now, did the doctor act wrongly? Should she have refrained from sticking you in the arm with this needle? I'm hoping that most of you are going to say yes. Of course she did something wrong. But why did she do something wrong? What made it wrong for her to do this to you? Well, one reason why it's wrong has to do with the first principle of bioethics, the principle of autonomy. Now, this principle states that medical professionals have an obligation to not interfere with patients' ability to make medical decisions for themselves. So when you said, "No, please, don't give me that shot. Is there anything else that you have?" She needed to respect that decision. And by going through with the procedure anyway and giving you the shot, she violated this principle. Okay, so the second principle, the principle of beneficence. This principle states that we have an obligation as medical professionals to promote the health and well-being of patients. Well, did this doctor promote the health and well-being of you by sticking you in the arm with this needle? Well, yeah, in a certain sense. She cured your headache. She healed you. You came in with a particular problem, and she fixed it. So yes, she acted in accordance with the principle of beneficence. Now, was there more harm caused by giving you the shot than good? Yeah, probably. Taking 10 years off your life is probably more harm than the headache. Some people, I guess depending on the severity of the headache, might disagree with that, but I guess that's a subjective call. But the point is, she acted in accordance with the principle of beneficence by curing your headache. But this whole weighing of good over bad, harms over the well-being of particular treatments, this brings us to the principle of utility, which states that, above all, medical professionals have an obligation in prescribing certain medications or certain courses of treatment to patients, have an obligation to promote more good than bad. Almost every medication, not just this shot in the example, almost every medication, every prescription drug, every surgical procedure, these all have negative side effects. And just because they have negative side effects, this doesn't mean that we should not go through with these treatments. In fact, we think it's definitely okay to go through with a lot of these treatments. But the principle of utility says, as long as there's more good than harm, then that course of treatment is okay. If there's more harm than good, then the treatment is morally inappropriate. It's a violation of the principle of utility. Okay, so far we have 3 principles. Respect for autonomy, which is respecting patients' ability to make medical decisions for themselves. Principle of beneficence, which is to promote the health and well-being of patients. Principle of utility, which is in every medical decision to produce more good than harm. The 4th principle is the principle of non-maleficence, which is very similar to the principle of utility. In fact, in the textbook, Lewis Vaughan doesn't give the principle of non-maleficence its own section, but he discusses it. And so I think it's important to talk about in this video. The principle of non-maleficence just means not to be the direct cause of a harm done to a patient. So not just to promote the well-being of the patient or to prevent harms to them, but to not be the direct cause of the harm. So now, in the example, when the patient or when the doctor stuck you in the arm with the needle, was she the direct cause of harm to you? Yes, she was. In fact, by putting that needle in your arm, she caused you to lose 10 years of life, and she caused you to become infertile. So she violated the principle of non-maleficence. Okay, as you're starting to notice, these principles come into conflict with one another. The principle of beneficence seems to say that, yeah, of course, she can go through this decision procedure. She can stick you in the arm with this needle as long as it's going to cure the headache. But since you said no, going through with the operation anyway and giving you the shot, that's a violation of the principle of respect for autonomy. Now, how do we weigh all of these principles together? If one principle says, go ahead and give this patient the shot, and the other principle says, don't give this patient the shot, they seem to be conflicting with one another. How do we resolve this conflict? Well, this is a very difficult question, and it's one that doesn't have an easy answer to. A whole bunch of cases that we'll be looking at this semester involve conflicts of principles. And exactly how to resolve this conflict, to say, well, which principle takes priority when the two conflict? Should we respect autonomy, or should we fulfill our obligation of beneficence? It's a very difficult question. In this particular case, the one in which the doctor gave you the shot, I think that it seems clear that she shouldn't have given you the shot. It seems like there are more considerations in favor of her not going through with the procedure than going through with it. But it's a difficult call. And we'll talk more about this as the semester goes on. Okay, the fifth principle, the principle of justice. This principle is a broader social principle, which states that no one person or group of people should bear more of the burden of medical practice than the other people or patients in society. So for example, some sort of medical procedure or medical tax policy or something like that unfairly targets minority groups, this would be a violation of justice. Or if a particular doctor decided that she wanted to only treat white patients and she didn't want to treat any non-white patients at all, this is a violation of justice too. We all have, or should have, morally speaking, equal opportunity to medical treatment, the same medical treatment that everyone else gets. No one of us gets extra benefits. No one of us should bear extra burdens. That's the principle of justice. Okay, so why are we talking about these principles? What's the importance of them? Well, first of all, the importance is it helps us get a starting point on some controversial ethical topics. A lot of us disagree vehemently when we're discussing things such as abortion or euthanasia. But all of us seem to, at least on some level, endorse these rules. In fact, I think we all think that we should respect one another's decisions. We all think that we should promote one another's well-being, that we're all equal, none of us should get unequal treatment, stuff like that. So if we can start with these principles, perhaps that'll get us at least part way to reaching some agreement on some of these difficult ethical issues. And we can use these principles when we're constructing our arguments. Consider, for example, the argument that we gave in the previous video when we were talking about abortion. The argument went something like this. The first premise is it's always wrong to kill an innocent person. The second is that fetuses are innocent people, and this leads to the conclusion that abortion is morally wrong, since abortion involves killing fetuses. Well, look at the first premise of that argument. It's always wrong to kill innocent people. Well, this is a violation of the principle of non-maleficence, which states that we have to do no harm to people. Well, killing is a form of harm. So the first premise is directly an application of the principle of non-maleficence. So we'll be using these principles, all 5 principles, to help supplement our arguments. We'll use them as premises in our arguments. Okay, if you have any questions, as always, feel free to contact me. I hope you're having a great day.